My name is Grace Wairimu Kariuki, and recently I go by the name of Grace Wairik because I got married when I went to the US. So I'm 48 years old and I'm a former lecturer. My last teaching position was at Jomo Kenyatta University of Agriculture and Technology, that is JKUAT, where I taught health information management. But previously, I had worked in projects. I had done USAID projects. I had also done human resource in various organizations. And for 11 years, I worked at Kenyatta National Hospital as a nutritionist. I went to the US in 2019 to visit. And while there, I liked the place. You know, I liked just the way United States is. And I came back after 1 month and I came ready to go back. So I'd wanted to go either to the US or to Canada. But when COVID hit in 2020, I had not yet finished my preparations. So eventually when things eased up, I left in December. I left here on the 19th of December, 2020. Then I went to the US and I intended to go and visit and stay with my relatives who are there because COVID brought a lot of challenges in terms of just mental health and financial challenges because lecturers don't have a lot of money. We rely on part-time teaching and projects, and towards that time a lot of our projects had closed and had been cancelled, and part-time teaching was not available, so it became very challenging. So I left intending to stay for a year or two or even 6 months just to clear my mind and decide on what to do next. But while I was there, I met a wonderful man, and he was one of the main reasons that I did not come back. I'm a mother of 3. My first daughter, Prudence, was around 19 when I left. My son, Leon, was 16. He was still in high school. Prudence had cleared and she was in JKUAT as a student, first year. And the baby, Jasmine, was 8 years. So when I went, I was at a very low level, at a very low point in my life because of all as a single mother and all the financial burdens and a lot of the mental health situation after COVID. So I did not take my kids with me because I needed time to clear my mind and decide on what to do with my life. To be honest, by the time I left in December, I was so gone that at some point I was even suicidal. So it was depression of a high level. Yes. So my sisters called me. I went. We stayed together, and I was able to heal to a greater extent. My kids are good. Currently, I've already managed to send my daughter to Canada, the first girl, and the other 2 are here in Kenya. I'm still trying to see how I can take them with me to the US. I had kind of raised my kids almost to a greater extent by myself. And the baby was young, she was around 8 years, so it was very hard. It was very challenging. You know, you wake up at night and all you can think about is your kids, and there's a lot of pain. But I needed to go in order to find myself because I wasn't going to help them if I wasn't alive, because that's the point where it had reached. When I went to the US, because I did not have any formal papers, and when you get there, the first thing that people do is you get trained in caregiving. They teach you everything from how to put on socks on an elderly person, how to feed them, how to position them in a chair. So you do a course that's called 75 hours. And with that course, you get registered in the Department of Health. You get a certificate. So with that, you are able to work, but you work as a volunteer first. And then you work with people to be able to gain experience. So at that point, for the first few months, you work as a volunteer. You go from one home to another, working, taking care of the elderly. Sometimes you work nights, sometimes you work during the day, and it's very challenging because these are things that are very lowly. Okay, I don't want to call them really, I don't know which word to use, but for someone who is not in the nursing profession, you feel like it is low work. Because when you go to work in someone's home and you are a volunteer, you start from sweeping, you clean the house, you clean the people, you clean the toilets. So basically, you are doing like a domestic manager. And then, so you hit by culture shock, because here you are with your degrees and everything. By the time I left, I was a doctorate student. I was doing my PhD in JKUAT. So it was very challenging to take your mind from up there to the ground to work and do all those lowly jobs. Yes, but one thing I discovered about the jobs is that they are very rewarding, especially for me because I was going through a very tough time. It was like an eye-opener. It was like a time to rediscover myself by giving to other people who are not in a position to help themselves. So you are working with someone who was a big person, with a big professional job, and now they are elderly and they are helpless. So it kind of wakens your mind up to the realities of life. So I would say for me, that time that I worked with the elderly, it was a healing time. So after I got trained, I applied for jobs with now different organizations. There are people who employ others, like they're called agencies. So I work with agencies because they pay like even twice as much as what you would be paid being directly employed, and the working hours are flexible. So you work with them, you can choose your own schedule. Yeah, but the problem with them is that sometimes they don't have a lot of work and they have a lot of people, so they split the hours between all the people who are there. So they send you to a facility, like a health care facility, and you go to that facility, you work there, but they get paid and they pay you some. It's like, I don't know, an agency. So that's what I work with. And during COVID, we were making very good money. For the 1 year and a half before COVID was declared no longer active, I made some good money and I enjoyed working. But in 2022, I enrolled for a course at the University of Washington. I got a scholarship. I applied for a scholarship and got. And I did a course in women's entrepreneurial leadership. And with that course, I started my own agency, because it's a course that would teach us how to do business, how to run an organization. They are supporting us in terms of connecting us with the community and leaders, and I was able to start my own company. I actually started 2 companies, one doing the agency that would send people to the facilities now. So then the other one I started, and that is part of the reason that I'm here in Kenya today, because it's a company that I'm sending people to study abroad. And through that, I was able to send my own daughter. When I sent my own daughter to the US, to Canada, people started asking her, how did you go? So we decided to start it together with her. The work of a nursing assistant is very heavy. It involves taking care of different kinds of people in most of the time nursing homes or hospitals. So if it's a hospital, you can work taking care of different kinds of patients, maybe patients who have come from surgery, things like that. If you are in a nursing home, you take care of people who have maybe just recovering from surgery. They are brought there for a few days before they go home. Or long-term patients who are there, who stay there even for 20, some of them longer. So depending on the care of the person, it depends. Some people you have to, when you get there in the morning, you're given your section, like you're working from room 1 to room 9. Then these people, maybe room 1, he cannot walk and he needs to eat in the dining room. So you go, you wake him up, you clean him, put him on the toilet, and you put him, if he's on a wheelchair, you put him on the you dress him up, put him on the wheelchair, make their hair, then you take them to the dining, serve them food in the dining. Some people are not able to leave their beds. So when you arrive there in the morning, you check their vitals, then you clean them up. You clean their diapers, you change their clothing, you change their beds, you set them up properly. Some of them you feed them in bed, and some of them do not even eat. You're just turning them as they wait for their last days. So it's a lot of work, but it also depends on the facility where you're working. We call them residents. Sometimes you can have even 9, depending on the facility where you're working. Some facilities are very heavy, and especially long-term care. They have people who have stayed there even for 19 years, and all they do is eat, and they are just being exercised a little. So you find those people gain a lot of weight. So some facilities are very heavy, and some of them do not want to employ very many people, or maybe they have shortages of staffing, which is a common problem in healthcare, even in the US. So you find you're there and you have 7 people, and maybe whoever was allocating the groups did not balance it very well. You find you have like 5 people or 6 who have to be lifted with that machine, and sometimes you need to ask for help, but even the person you're asking for help has a lot of work, and like breakfast is served within this time. So you run around, you run. You see these shoes I'm wearing? Those are working shoes, because if you just wear any shoes, you'll hurt your back. Your feet are paining, they get swollen. So you buy special shoes that you can be able to run around with. But we do a lot of work. The other challenge that I found is we come from a culture where people are good to each other, but when you go to the other world, people don't care. You're helping them, and they are insulting you and calling you names, calling you a slave, calling you any name that cannot even be printed, and you are there, you're helping them. And it is very heavy on the mental state of a person. We cry a lot. When you are starting, you cry a lot, and you ask yourself whether that is what you really want to do. But of course, when you look at the money that's going into your pocket, and when you remember how everyone at home is crying about money, and they don't have jobs, you just focus again and go on. But crying, you have to cry a lot. By the time you harden your heart and you harden your skin such that even if someone calls you whatever name, it doesn't bother you, it takes a while. I decided to start my companies because I would want to leave the job of caregiving. personally to be able to employ other people to do it for me. So one of the companies, I would employ CNAs and caregivers and send them to facilities to go and work there. I get paid, then I pay them, and I leave some money for myself. So you can send them to facilities, or you can send them to the caregivers to people's homes. There are people who are not taken to facilities. They stay in their homes, so you go to their home, you assist them with whatever they need based on the care that they have been prescribed for. So if this one has been prescribed, you go and help them to take their medication, you wake them up, you cook for them, you take out their trash, you do their laundry. That's what you send someone to do. I'd always had a dream of working with my community back home. Recently, we've had cases of students really wanting to go abroad. I had not wanted to start it immediately, but when I helped my daughter to go and people were calling her and asking her how she did it, we decided to start it. And
the same year this year?
The same year this year.
Which month?
I started it around June. And it just picked up, because when I posted like on FB, and I got overwhelming support from people asking me how I can help them. So I actually put the other one on the back burner, and this is now what I'm concentrating more on, and I'm seeing it's going to do much better, because people are very interested in sending their kids to study abroad. I also realized that there are so many scholarships. Like, for example, you go online, there are so many scholarships, and many people do not know how to apply for scholarships. I received a Commonwealth scholarship myself to study my master's, and I know it's a very tedious process. So what we do is if we see a scholarship, we help anybody who is willing, we help them to apply for it. Kenya is very challenging, because many people, even like young people, don't have jobs. So, and even many people who get jobs here, they are not very well paying. So if someone gets a chance to go abroad, I would tell them to take it. Find out about the place you are going. Try to see if you can connect with people, other people who are there, and also listen. Listen to the people on the ground, not to discourage you, because there are people who discourage you and tell you, oh, don't come here, it's very bad. It is not as bad as here, but you have to strengthen yourself and strengthen your own self, because nobody can come and push you forward. You have to push yourself. But if someone gets an opportunity to go abroad, it is good, because it also opens your mind. You learn new things, you meet new people, and even if you are going just to stay for a year and come back, you come back with a different mindset. When you go there as an immigrant and you hear the stories of other immigrants who came with nothing, and how they've been able to scale and do big things, I think I'm ready to follow in the footsteps of people. And the good thing is that there are many people who are willing to mentor someone. When you show that you really want to move forward, you find that there are people who are willing to mentor you and to show you how to do things. And that's what is happening to me, like with the University of Washington. They've connected me with different groups of entrepreneurs who are mentoring me and others to be able to move forward. So I think the future is bright. I have websites for the two companies. The first one is Zuri Staffing Agency. That's the one that does staffing solutions. And the other one is Moss International Education. So that's the one that helps to take students abroad, experiences, and a lot of other things that I have gathered, the information I've gathered on the ground. Life is good. I cannot believe that I'm the same person who wanted to take poison 3 years ago and kill myself. I'm glad I didn't do it, and I will be a testimony for other people. Yes.
Thank you so much.
You're welcome.